Lovely. Oh. Guys, welcome to today's live session. I'm going to be kicking off with a brief little chat about why your herniated disc feels like it's spreading. And I do hope that this is going to help some of you guys that have had lower back pain for a long period of time. It's the subject material of an upcoming article. And I'm kind of coming to you guys to talk a little bit about it, be interested to see some of the questions and comments that you guys have on this particular topic. But there are just so many people that are struggling for such a long period of time with lower back pain and sciatica, and they come to the program or they come to the clinic in a spot of bother, to say the least. And they're struggling with their ability to perform exercises, they're struggling with their ability to get through daily life. And hopefully this little chat will help you at least understand why you're where you are. Because sometimes we feel like it's something that's terribly wrong with us, and when we start to realize that actually it's the way the body works and that it is reversible in many ways, we can start to at least see a little bit of the light at the end of the tunnel. And what I'm talking about here is this scenario where you guys maybe have an L4-5 disc bulge, or I'll try and be consistent here, L5-S1 disc bulge, or herniation or injury to the lower back, right? And you've maybe got some lower back pain. You know, we've injured the bottom part of the lumbar spine down here. And maybe it's a bit of back pain, maybe it's a bit of buttock pain, maybe we've got a bit of tingling going down the leg, some sort of sciatica, right? And it's there and it's bothering us, maybe to a greater or lesser degree. But if we don't deal with it effectively, we start to shrink away from what we're doing on a daily basis. We start to do less and less and less. We try and avoid certain things that might be flaring it up. And we end up just massively decreasing our level of daily activity. And this has some real downsides to it. And I want to just quickly point out a stat which I've mentioned to you guys before, and it was kind of like a target thing that I remember reading about the NHS here having the target of you guys, if you've got a back injury, being seen by a specialist within 18 weeks, I think it was, which is incredible, absolutely incredible. And so what happens in the individual is you have a lower back injury, and this is why it's so important to understand and deal with these back injuries correctly first thing, rather than allowing them to, you know, just be dealt with poorly, ignore them, let them go away, try and just take some painkillers or just kind of get over it, or whatever the advice might have been. Why it's important to deal with them immediately. Because what happens is we've got this L5-S1 disc injury and we stop doing more and more. And so what then happens is we decondition. A lot of people don't realize that the body is constantly in this state of flux. It's building itself up and it's breaking itself down and it's responding. It's the same reason. For example, I've had, as you guys know, I've had a couple, well, as you guys obviously know, because I've got the eye here, but as you guys will know, I haven't been training, right, the last 2 weeks. So since my last jiu-jitsu session, which was the Saturday before last, I haven't done any training because this needed to get better. As you guys can see, the eye's swollen, not swollen anymore. It's just a scab that needs to heal. But I've been relatively inactive. I am not as strong as I was 2 or 3 weeks ago. I'm just not. And that's the truth, okay? I did do a very light session yesterday with Dad, doing 60 kilos on the bench, I think it was 70 actually, 60 kilos on the squat, and some light pulls, just to see how my body felt. And it felt hard, it felt tiring. It'll come back in no time, but the point is you decondition. And some of the research I've been looking into ahead of this article was talking about the fact that it's weeks, days and weeks of significant inactivity will lead to muscle loss. And a lot of the stuff is talking about muscle loss, but and that's mass loss, but the strength losses are significantly greater in those relatively short periods of time. And then we start thinking about the bones, we start thinking about the integrity of the joints, the discs themselves. One of the interesting bits of information that I've come across as I've been going through this, you know it, I know it anyway, but it's just revisiting these things, which is very, very interesting, is the presence of the thinning of these discs through periods of inactivity. Well, wait a second, Mike. I thought the degenerative thinning of the discs was because I was wearing and tearing it. No, you weren't doing anything with it, so it degraded. Very, very interesting paradigm to start thinking about, because a lot of people say, well, Mike, I've got degenerate discs. I can't get better. It's like, maybe the inactivity's got something to do with that. Very important to think about. And so we go through this scenario where we have an injury at L5-S1, which is a relatively simple injury. There are many people who will have those of varying degrees. I was only speaking to someone yesterday talking about another individual who had a very large herniated disc, and within a very short period of time, weeks to a couple of months, was back squatting 100 kilos. Now that is an out of the ordinary individual, But the point remains, they had a lot to lose, so they can bounce back relatively quickly. A lot of people, as we've been discussing over the last few weeks, 95%, it was I think 97% for women and 93% for men, something like that, do not do any sort of resistance training and have not done so for any length of time. And therefore, you don't have a lot to lose. If the heaviest thing you've lifted was maybe your toddler in the last 6 years, before you had a back injury I'm talking about, you don't have a lot to lose. And so a relatively short period of time can put us in a position where we're not very strong at all. And so then what happens is we have this L5-S1 injury, it's dealt with poorly, so we do less and less and less, so we get weaker and weaker and weaker. And then we start to find, oh, my hamstring tendon's bothering me a little bit, and now I think it's something different, but it's not. I go to the doctor and say, oh, you've got hamstring tendonitis. You don't have a back injury, you've got hamstring tendonitis, so we'll do that. That doesn't really fix anything. Now we've got a back issue and a hamstring tendonitis, and we do less and less and less. So the integrity of the entire spine, everything else, the load-bearing joints in particular, which is the spine and the hips, the bones themselves, degrade further through this disuse because we're sat down all day now trying to do nothing, lying down, sitting down, lying down, sitting down. Many of you guys will be familiar with this or know people that are. So we get weaker and weaker and more vulnerable, and we feel like we're in this downward spiral. And now, well, no wonder no treatments work, because we're so vulnerable. We have what might be a good treatment. And then we walk out of the clinical environment and we flare ourselves up again. We irritate something else that's weak because the pain might have been repleted. This is where the focus on pain relief is wrong. Yes, in the first instance, in the moments that you've done it, when I've just done my eye, for example, if you've just injured yourself, sure, the utilization of not having to suffer unnecessary pain is perhaps appropriate, or definitely appropriate in certain cases. But long term, having pain relief as a strategy, I'll just take some pills and carry on, as too many times I've had that conversation with people over the years, I'll carry on doing things that make the problem worse, is not the strategy. And so we're very, very weak. And we continue to injure ourselves. And then we start thinking there's lots of different problems going on. Really, it's one problem that's just been dealt with poorly that has allowed us to decrease the conditioning of everything. Well, the good news about all of this, which sounds quite dire, and I'm going to make sure that I do my best to get this across when we do the full article. And guys, if you've got any questions on any of this stuff, please do post down below, and I'll get to some of the questions in a second. The rub for this is you can get better. These are two-way processes. Yes, it's more difficult if you're rebuilding from a very significant position of weakness than if you're a little bit stronger, but you still can rebuild the strength and the health in the lower body. You still can rebuild the strength and the health in your spine. You have to be careful. You have to be cautious. But if you're following through with structured rehabilitation work where you're actually getting guidance, you can rebuild the strength in the lower back, the strength of the discs. You can rebuild the strength of the hips and the tendonitis that you've got in your hamstrings and the glute tendinopathy and the calf tendinopathy or tendonitis that you've got and that plantar fasciitis that you've got and that weakness in the calf and the hamstring and the glutes. That can all be rebuilt. Understand it gets lost faster than it is rebuilt. Understand also that it is rebuilt when you're actually working hard. So one of the comments that we had the other day, I saw in the group, was one of the guys like, I'm on phase one. I've just started doing phase one and I've been doing it for a week. I said, okay, you're doing the live session for a week and I haven't heard the comeback, but I'm going to pretend that I know what he's going to say because we've had it time and time again. This is one of the important reasons why we did some of the work in the revamping of the program earlier this year. We say, well, I'm doing the live workout and I'm not getting an aggravation. Great, we're following the instructions. But once you can do that thing, it's not getting you any stronger. So those guys that you learn, you say, okay, can I do the squats? Okay, I couldn't do them to start with. I kept on messing up my technique, but I've got it now. And I can do a squat carefully. I can do 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, is that building any strength? No, no, that's not building any strength. And I want that to be very, very clear to you. Maybe a week ago after you'd been in bed rest for an extended period of time, you couldn't do that, right? Maybe a lot of it is technical, but doing 10 bodyweight squats, if you can do 10 bodyweight squats, almost guaranteed, no matter how bad you are, you won't finish rep number 10 and be like, I would have fallen over if I'd have done 12, right? Which means you're not building strength. We know this anyway, but sometimes it bears repeating to make sure that your expectations are very, very clear and correct. Because we get a lot of people that do a lot of the stuff that you see online in the program, the core 5 exercises. They see the videos on YouTube and say, I'm going to do the squats, I'm going to do the hip hinge, the dead bugs, whatever it may be, and I'll do 10 reps. and they're still doing 10 reps of the same thing 6 weeks down the line, 6 months down the line. That is not strengthening. If you could do 10 reps 6 months ago or 6 weeks ago with body weight, continuing to do body weight is not strengthening. Now, one of the important things about the program, and this is something that often isn't borne out, is that what are we trying to do with our rehab to recover from back pain, to fix these herniated discs, to stem the degradation of health, resilience, and well-being that starts to go through our body, through the disc use atrophy, breaking down of the tissue because we're not providing it the necessary stimulation to stay strong or build strength. One of the most important things is that we first establish correct technique. This is what we talk about in phase 1 and 2 of the program. You're learning how to perform the things safely. Just like the child that is learning to ride a bicycle, we set up an environment in which they can learn as well as they possibly can. Maybe some stabilizers, daddy holding onto the handlebars, the seat, whatever it may be. We must establish good technique first. And all things being great, you would have done this before you ever started to injure your back, before you went into the gym. This is sensible training for everybody. How many of you guys, we're going into December very, very shortly. How many of you guys in January are going to boom, straight, or know people that will, straight into that class January 1st, 2nd or 3rd, and they start hammering themselves and they haven't trained since last January, mainly because they injured themselves because of this approach, right? You have to get technique right first. And in a rehabilitation state, recovering from back injury, it's vital. And then in phase 2, for example, we practice the choreography, right? Because some people will find that going from a squat like this to holding something throws them off a little bit. Their center of mass, they feel alien, and that's completely normal. Everyone has different abilities to get into these things. Everyone has a different starting point, right? But they learn to take the squat. This is not, doing 10 of these is not really significantly harder than doing 10 of my body weight. And I had this, one of the ladies posted in the group yesterday. I said, gosh, I did the phase 3. I did 16 kilos on my squats, and I thought, do you know what, maybe I could have done a little bit more. Because that's what you do in phase 3. You then need to find what the right level is. But if if you've been doing body weight squats for the last 6 weeks, and tomorrow afternoon, if you do a proper workout, you go and find out you can do 16 kilos with a kettlebell, you haven't been working out at the appropriate intensity for a long time. Because that is actually the correct intensity. But we need to have a safe foundation so we don't mess our back up. Because if you're doing this with your squats, or this, and that's your squat, and you go, oh, I'm okay, Mike, that's not correct technique. And if we then start playing around with a bunch of weight, you know, 20 kilos, like this, we're going to get into trouble. And we're going to get into trouble real quick. So we have to make sure that we're doing things sensibly. This is one of the important things that we really talk about in the program. Daniela said, this is me. I need to get out of this rut and rebuild a routine. That's what the program's for. That's the routine. That's the plan. That's the details that you need to go through. One of the guys on TikTok has said, I just had an epidural cortisone injection for my L5-S1 herniation. What can I expect now? The most important thing, I think there's a couple of things to think about here, right, actually. Number one, now I'm saying this on a call, I'll try and get it right. Understand that the surgeon that has done the injection has just poked this with a needle. They put some stuff in the epidural space in there. Your disc, your spine, the herniation, the ligaments, is absolutely no stronger, healthier, or anything after having that epidural injection. None, at all. At all. And I think sometimes it's actually worse if you get a good response from the epidural. And the scenario in which this is certainly true is a scenario where it is not done in a conjunction with rehabilitation. I will do an epidural injection. It should be good for about 6 months, and then, see how you go. No. Because probably the pain that you're experiencing when you did certain things with that herniated disc was the only thing that was stopping you making it worse. The inconvenience of that pain is the only thing that was stopping you making it worse. And now all of a sudden the pain is gone and you think the problem's gone. The injury is still there. That is the most important thing. That is the most important thing to be mindful of in that particular scenario. The injection is doing nothing. Now, can you leverage? Have we had members of the program, patients over the years, that have leveraged an injection in a sensible and responsible manner with good surgical, specialist, orthopedic surgeon, neurosurgeon, whatever it may be, with good advice and guidance from those guys in conjunction with their rehab, yes, yes, yes. But equally, we've seen a lot of comments and had a lot of patients and had a lot of members over the years that have just been given the injection and on you go, off you go. And that is not good. And that is almost willing you into having a bad response to it and then thinking the injection didn't work for me. The other thing to bear in mind is, as we've been talking about on this session already, is what condition are you coming into this procedure in? A lot of times, certainly here in the UK anyway, you aren't having an injection after having the back pain for a couple of days or a couple of months. It's more likely months to years that you might have been struggling and say, we'll give the injection a go, we'll try it because nothing else has really worked. And so having an honest appraisal of your current level of strength, stability, resilience, this is why the exercises are so important, because if you can't even lie on your back and do a simple exercise like a dead bug, wiggling one leg without your spine moving all over the place, then we have a significant degree of weakness. And what's to make us think that we're only safer leaving the clinical environment after having that injection, and we're not just going to mess things up again? A very important consideration. It needs to be done as part and parcel of the process. Meaning, whatever treatment or intervention we have from a specialist, if you're going to see an osteopath, you're going to have some spinal decompression, some laser treatment, an injection, a once over from your massage therapist, a physiotherapist appointment where they're going to do some of X, Y, Z, your chiro, whoever. The surgery, that is at the top of the pyramid of what you're doing to get better. It needs to sit on a strong foundation of rehabilitation and education. I would argue equal parts, maybe even more on the education front, because that's what helps you outside of the clinic. We can't be woefully inadequate in terms of our strength and our stability and the structure of our spine and expect a 2-minute procedure, a 5-minute procedure, a half-an-hour appointment to undo all of the bad we're going to do over the next 168 hours a week before we see the guy again or lady again. You've got to think about these things. User here has said, what do you think about laser? I think laser is fantastic if you're getting a proper laser done. So we use the K laser. It's class 4 laser. I would say it's fantastic. I mean, I used it on my knee. I obviously benefit from being able to use it as much as I want. So for example, when I tore my knee meniscus a couple of weeks ago, or a couple of months ago now, June, ahead of competition, I was doing it 3 or 4 times a day for a week, every day. And then afterwards, I kind of tailed it off. I haven't done it in a while now. And as you guys might or might not know, I've mentioned it before, back up to squatting 100 kilos. I've used it on my brother's tendon, and then pec tendon, complete rupture. In 6 months, we were back up to him bench pressing 100 kilos, having not been able to put any pressure through him. It's completely torn. It's never going to look the same again, but we rebuilt strength into that area again at a pace that was ahead of that, which was expected by the surgical team. But those are just some personal anecdotes for me specifically. I've been using it for years on patients, and it works. It's good. But again, it's not magic, right? You can do a laser treatment and then you can walk out of the clinic and do some silly things and you'll mess yourself back up again. That's why I argue more and more these days, do your rehab before you spend money on treatment. And then the treatment can enhance the rehabilitation work. Because quite honestly, for most of you guys, especially if you're struggling in a pretty dark place with your lower back, it's bothering you, you're struggling to leave the house. The action of going to the appointment is likely to be more problematic than anything that is done in the clinical room and than anything else you're going to do in your rehabilitation. So build better strength first, then go to the clinical team and get a little bit of support so they can build on a good foundation that you've already done. You can't finish having a lovely session. Maybe you do some laser on the lower back, we do some decompression like we do in the other room over there behind the wall. And then you finish the session, you go, oh, Mike, I'll go and put my shoes back on after you've done the treatment. You can't do that, but that's instinctive. I mentioned yesterday or the other day when we did the live, one of the members uploaded a video and there was someone else in the background of the video. They were in the gym and the lady just walks over behind the member in the background and you see her literally straight legs, bends all over from the lower back to pick her phone up off the floor. It's like, man, what are you thinking? Those kind of habits is the point is you're not thinking. You're not thinking. But those kind of habits will be fine when you don't have an injury. I would argue it would be better if we didn't habitually do those things because it doesn't make sense. But when you then get an injury, you can't get away with those things and they're so subconscious you don't even know you're doing them. And that's where people say, I wasn't doing anything and my back got worse. It's like, no, nobody does nothing. I said on a video yesterday, because I had the plants behind me, I said, not even this plant does nothing. It turns and faces the sun. You can see it over the course of a couple of days if you turn the plant around, then the leaves start going towards the sun. Not even a plant does nothing. So you guys certainly don't do nothing every day, but you might not realize why the back is being flared up, but it's certainly not because you did nothing, because nobody does nothing. What else have we got in here? Guys, those of you on YouTube, if you've got any questions, do post them in the chat. I know there's a little bit of a delay. Just looking through TikTok over here. What's your YouTube review of the decompression device? Are the ones on Amazon the same thing? I'm not sure what device you're talking about there. Do let me know if you can give me a bit more details. Chelsea said, are magnesium salt float tanks and dry needling a waste of money for herniated discs? I wouldn't say a waste of money. Let me explain. You being stressed up, locked in, and that kind of stuff is certainly not going to be helpful. And if you can be in a low gravity environment and chill out for a little bit, and dry needling is going to work on the muscles to ease some of the muscle tension you're experiencing, as long as you understand precisely what it is doing, Chelsea specifically, or you guys, whatever treatments you're going, you need to understand precisely what treatment is actually doing. In that scenario, it might be decreasing your stress and taking a bit of pressure off your back. As long as you know that, and the guys at the clinic or at the facility are not saying this is going to fix your herniated disc because they're lying, this is going to help you manage things, and it doesn't sound like it would be doing any harm while you do your rehab, then that's okay. Where we have issues is to say, well, I'm going to fix your herniated disc for you. It's like, no. Fixing herniated disc, you're doing the healing, no one else is doing it. Now we can make the statement that certain treatments might be helping the healing process in a more direct manner, such as laser, for example. But you're doing the healing. I'm going to help you. I'm going to do some treatment. For example, in the case of the acupuncture, that's doing precisely 0 for the herniated disc. But if the acupuncture is meaningfully releasing some of the tension that's in your hamstrings, and you get a notable increase in the range of motion of the hip joint after your acupuncture treatment, that is going to be taking some pressure off the hip, off the lower back by improving the mobility of the hip, which will have some kind of delayed benefit, at least until you next flare your back up. So you've got to make sure that you pair that kind of stuff with rehabilitation, with strengthening work, and then it can be deployed. Now, you also need to ask the question with regards to the float tanks and that kind of stuff, is it worth it in the early stages of recovery, or actually could those things be a little bit more helpful once you've got into a baseline level of competence in your rehabilitation work? That's something to think about, and needs to be evaluated. Was it keep much of the same but progress the rest of the exercises? It was a portable lumbar traction device. To be honest, I'm not sure exactly which ones. You're going to have to, I probably can't effectively do that on, troubleshoot this on a live session with regards to that portable lumbar traction device, but I would say the towel is by far more than sufficient for most of you guys. I think that a lot of, the only one that I think routinely I say is better is for the neck. A neck towel isn't quite as good as using like the neck cloud device, which is like £15 on Amazon. It's under $20, I think, most of the time. That's the only scenario where I think the towel is worth replacing. But for more or less all of you guys, the lumbar towel like that is the best, right? Where appropriate, you can use something like Epidurals, but most of you guys don't need that. And you need to have x-rays to understand if that's even appropriate for you. So please bear that in mind. I wouldn't I think generally speaking, spending the money on some of those devices, which can be quite expensive, is not significantly worth it, I would suggest. You're better off, if you're going to spend a little bit more money, going into the hundreds of pounds, looking into an inversion table instead. When do you recommend strengthening and rehab post-microdiscectomy? Ali, I personally suggest immediately. And the reason for that, and this is, depending on when you've had your microdiscectomy, you want to talk to your surgeon about this specifically, and troubleshoot this idea. But the simple fact of the matter is you're going to be getting out of bed in the morning. You're going to be getting off the toilet seat. You're going to be doing many things every single day, even while you're being careful, that involve movements like a squat. And so knowing that you're going to get out of your bed, which is this high off the ground, you don't levitate to get off the bed. You have to get out of the bed. So the idea that some rudimentary training on how to perform a squat wouldn't be helpful, I think is difficult, right? A lot of times, the surgical team, and it's worth having a conversation with your surgeon, right? Especially if it was relatively recent that you had your surgery. Typically, they'll say, oh, we don't do too much rehab until you get to the 6-week period, and then boom. But you need some guidance. You can't just sit there floating in space. You're doing stuff every day. And I would argue some significant delving into proper rehabilitation, arguably before you even have the surgery, is going to be worthwhile. It really is. It's silliness to suggest that you're not going to do anything and just walk. That's not guidance. You've just had a procedure that you've really maybe agonized over whether it's worthwhile having to get this bit of disc removed from the spine. You've agonized over that. They've told you it's a really, really good procedure and we're going to do things really, really focused and it's the best with all the technology. And then the rehab is, yeah, just walk a bit and don't do too much for 6 weeks. That's a very sharp drop off in terms of the perceivable care that was there for the surgery, which attracted a nice little fee, and the rehab afterwards, which they don't really have any benefit in. Right? And I'm being a bit cynical there, I know, maybe more so than I usually am, but it's worthy of consideration. There needs to be a better, now the surgeon, I would argue, is not the person to do it. It's the person to talk about it with, but they're not going to be the one that can give you the rehabilitation, because the amount of times some of these surgeons will say, go and do swimming to strengthen your back. It's like, man, it'd be better if we didn't say anything. It would seriously be better if we didn't say anything in those scenarios. Brad has said, hey, Mike, I'm back to my life, better than ever, and I still thank you every day. People, stick with it, immerse yourself in the education, and do the work. Thanks, Brad, that's awesome. I really appreciate that. Like, the education, I think Brad would probably agree, and I know many of the other members will be. The education is the big thing, but the education is not what people want. And the amount of times I get people on the videos, and I'm sure they'll get some comments on this, just shut up and show me the exercises. It's like, man, there are how many videos on how to do a squat, dead bug, marching bridge? They're not magic exercises, guys. They're not. But doing them with care is important. I was having a conversation with someone in the members area the other day, actually this morning, about the dead bug. Like, most of you guys have been told about the dead bug. It's not a magic exercise. But how you go about doing it makes a difference. Here's a dead bug. Go and do that at home. Yeah, you just do this with your arms and legs and that's it. Yeah, it looks okay. Great. We've got 20, 30 minute, maybe even an hour's worth of content on the individual exercises, each of them, so you can do them correctly and with guidance and with support, etc., etc., etc. Like, you need, how you go about doing exercises, I would argue, makes the world of difference. And the education is so important. Remember, your exercises, you might be doing maybe an hour worth of rehabilitation stuff a day. But what are you doing in the other 16 to 17 hours you're awake? There's no guidance. There's no thought. There's no care. There's no attention. All we're thinking about is trying to avoid the pain. But that's not a plan. That's not a very good plan. We want to have a bit more strategy. So the education helps you address the time that you're not doing the exercises. Storyteller said, how to activate the glutes while hip hinging, and should we practice deadlift without any weight for sciatica rehab? Follow the program. We don't include deadlifts early on, primarily because a lot of you guys struggle with the range of motion on the hip hinge. There's no point adding in the deadlift. There's no point. You're kind of doubling up for a squat. And how to activate the glutes, I think we're getting this idea of glutes being asleep and activate the glutes and oh, the left glute isn't working. Disregard that kind of stuff. In an individual that's so very weak, you're just adding layers of complexity. Just do the hip hinge properly. Your glutes will be doing something, right? If you're doing a hip hinge, if you're doing a squat with correct technique, your glutes will be doing something, just because you can't feel them. How do you know that the reason you feel your quads and not your glutes isn't because your glutes are actually reasonably strong and your quads are the thing that's weak? Often you will find that the weaker area is the area that you feel most, is the area that tires out soonest. For example, when doing a chin-up or a row, people often will report that their bicep gets tired before their back muscles do, because the bicep is a lot weaker than this huge sheet of lat muscle, right? And it's the same thing here. People are getting bogged down. Oh, my glute, I got told my left glute wasn't firing, so I told do some bridges. No, no, no. If you're doing a hip hinge, it's not like your glute is off. If your glute was off, you would, it's not, right? Focus on doing the exercise with correct choreography. If you're doing a good hip hinge or a good squat, your glutes will be working. Focus on making good progress there. Because you've got this scenario where, and understandably so, you've been struggling for so long, you're worried about everything, you don't want to do anything wrong, etc., etc. Just focus on doing the thing right, rather than worrying about what you think is activated. Because quite honestly, you don't have the competence to make an informed decision on what you're interpreting. A great example of this is tension. People say, I feel tension, I feel tightness, I need to stretch. No, 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 no. How do you know that the tension that you're feeling is not an elongated muscle being held in an elongated position and needs the tension taking off it rather than more stretch? You don't, because you just feel tension. You ascribe that tension to a muscle that is shortened and contracted, but most of you guys, if anything, your lumbar erector spinae muscles are being held in permanent stretch. That's just one example. Yet you feel tension. What you feel or are not feeling is fine, but don't let that drive you. Focus more on the exercise itself. If you're struggling to perform a hip hinge, are you performing it correctly? If you are, great. I'm not feeling too much there, other than I can feel like get a bit of stretch at the bottom, my hamstrings are stopping me move because I'm a bit more in tune with these things. But also remember, if you've got an injury to the lower back at L4-5 or L5-S1, that controls the musculature here and down in the leg. It's not beyond the pale that you aren't going to have a very good awareness of what's going on in that area because there is a dysfunction there. And so trying to then do some sort of peculiar one-legged exercises, which are vastly more complicated than a simple squat and hip hinge, ends up with people just tying themselves in knots and you don't go anywhere. Focus on building strength and stability in the simple movements. And once you've built a good degree there, then go and have a look to see if there are any other areas that need a little bit of tidying up. What else have we got here on TikTok? Just having a look through the comments here. What are good exercises for psoas muscles? We're probably getting a little bit down into the weeds there. Is leg press machine safe or best to avoid after disc protrusion? I do not think the leg press machine is something that you guys with back injuries need to be worrying about using at all for the significant future. The significant future, I mean. Forget about it. You don't need to do it. You don't need to do it. Most of the time, if we're talking about a leg press machine, we might be talking about the one where we sit in and the weight's above us and we're pushing our legs away. You're just going to end up rounding your lower back. And if you're doing it correctly, you're just going to end up strengthening your legs disproportionately to your lower back. We want movements that are giving us additional spillover benefits. That's why we do the squat and the hip hinge, because those are movements that you will not go through a day in your life, no matter how bad your back is, without doing them. So we start with the squats and the hip hinges. The leg press, how often do you lie on your back on the floor and just press your legs away? You don't. So leave it out. The tendency also to tuck the bum under. When we're in the leg press, we're seated in this position and we go to do a leg press. As we get to the bottom, our bum comes in and boom, we go away and we think the leg press, quite honestly, is just an ego machine. It's just to make you feel good about using, you know, and hey, I've been there. Don't get me wrong. I'm not saying this from any other, but why are you doing the leg press? Because you like the feeling of putting a ton of weight on the bar and leave it out. Just leave it out. Leave it out. What else have we got here over on YouTube? And guys, how long have we been going? Just over half an hour. Guys, we've still got plenty of time, so if you've got any questions, post them down in the comments. I'm just going to go over to YouTube, have a look at some of these. Do you think at approximately how long can it take to get to phase 3? It really depends on you. This is one of the interesting things, right? And hopefully this comes across right. Everybody's got questions before they start. Oh, well, what about my condition? What about my this? What about my that? How long is it going to take? How long is it going to take? And this is where whenever I do virtual consultations or calls, I always try my best to insist. I don't want to speak to you until you've done some of the program. Because you can't answer those questions until you've done some of the actual exercises. I don't know how long it's going to take you to get to phase 3 and start adding load. And you don't know, and I don't know. Until I see how good you are or aren't, or how much you struggle with the simple exercises, what I can tell you with reasonable confidence is after doing, not after starting the program. Because when you start the program, you're going to go through the material. Now, different people go through the videos in different time frames, right? But generally speaking, I would say after starting, if you're sincerely getting stuck in straight away at day 1, as most people tend to, after a week, you will have tried the exercises. And more or less all of them, and you hopefully, if we've been doing it sincerely, devoting enough time to it, we will have done the full routine at least once, or if not, we've got specific reasons why we haven't, and we're exploring those individual exercises. That can give us a very good guide as to how quickly we're likely to get into the phase 3. And therefore, if by the end of a week you're doing the full routine, there's a very good chance that within a week or two, certainly within the end of the first month, you're going to be in the phase 3 level. Because that's where most people need to spend most of their time, is phase 3 and phase 4. So there's a very good chance of that being the case. However, if you start doing the exercise and you're really, really bad and you're really struggling and you need to do some more troubleshooting work and there needs to be a bit more back and forth in the members group and stuff like that, then it might take you a little bit longer. The area that most people spend most of their time in is phase 1 and then hopefully phase 4. Because phase 1, you've got to learn how to be safe. And that can take a bit of back and forth. It can take a bit of work. Might have questions, all that kind of stuff. But we only learn that through doing. The only way you can get a more accurate prognosis, if you will, timescale, is by actually doing the early parts of the program, realizing where you stack up compared to a normal human being, and then you can see how much ground you've got to cover. But you don't know by just sitting there thinking about it. We've been thinking about it for so long. We have to get some new information. Reevaluating the old information over and over again, it isn't really going to give us, in most cases, any new information. We want to know specifically what is happening on these. When I do a dead bug, I don't want to know that it hurts. I want to know precisely at which point in the movement did it create a degree of aggravation. That's what we want to know. Was it rep 1? Was it rep 5? Was it rep 7 when someone rang the doorbell and you lost your focus? All of these things mean different things. Some of them we can dismiss. Some of them we need to act on. Some of them mean we need to use an easier variation. Others of them, we need to just focus a little bit harder. There's lots of different variations, different bits of information. What else we've got? Kate has said, I herniated the disc in June, both sides. I was pain-free until 2 weeks ago. The MRI confirmed the disc bulge had gotten bigger. The advice didn't help strengthen my back. I don't know where to start now. I'm not sure what the advice was, Kate, but you start with the rehab. There are lots of scenarios where people have disc bulges. I mean, this is one of the things that gets people, right? Is you can have asymptomatic disc bulges until it's not asymptomatic anymore, right? I don't know what happened, Kate, when you herniated both sides of the disc in June. Was there an MRI there? Maybe, maybe not. Maybe it was already herniated before June, and June was just an activity where you made it worse. Remember, those tissues are healing every single day. They're trying to get better every single day. That is a normal part of the body, or normal process within the body. And you'll get people, I remember speaking about this for a little period a couple of months back, where we have one person that says, I'm feeling loads better, and boom, the herniated disc is worse. Someone else says, I'm feeling worse, and the herniated disc is actually getting better, and the other person's a repeat of the first. That's not so helpful. The MRI is helpful information, but there could be a number of different things. The pain that started again, for example, I'm just going back up to this comment here. 2 weeks ago, the MRI confirmed the disc had gone bigger. I was in pain-free until 2 weeks ago, right? So it might be that the aggravation, the irritation was actually getting worse over that time. I don't know what exercises we were doing. I don't know what led to that, but you guys are all going to have flare-ups along the way. If you're focusing on spine stability exercises, most of the time the flare-up is going to happen from daily life. Apart from when we're learning the exercises, we can irritate ourselves a little bit there. But most of you are going to flare yourself up outside of the exercises. That doesn't mean you change the process. You don't need to change, you just focus on building spine stability. Now, if you're doing the wrong sort of exercise, if you're doing knee hugs and child's pose, stuff that's not building any kind of resilience into the back, arguably creating more instability, then that's an issue. But assuming you're doing the right sort of stuff, the stuff we talk about, building strength and resilience into the spine, then you just need to carry on and know that there are going to be flare-ups along the way. Nyla said, during herniated disc recovery, I'm feeling pain on the right side, SIJ, but I'm not feeling pain in the leg and the disc. Okay. Crack on with the rehab. Crack on with the rehab. If you're talking about recovery in the broadest sense, so from one day to the next, I'm feeling X, Y, Z, fair enough. If you're feeling those things during the exercises, you need to specifically dig into when am I feeling those aggravations. Remember, we talk about aggravation-free with correct choreography. This is very important. So we should not be feeling any aggravation during the exercises. If we are, we're doing something wrong. And that's why we have the videos. You guys, those of you guys that are in the members area, post a video in the group. Let us know. Hey, Mike, when I did the squat, it was at this particular point that I started to get some aggravation, and it was giving me that pain. All I need to know is that there's aggravation, right? It's helpful if there's a little bit of extra information, like I'm feeling over the right side. But the other day, I can't remember where it was. Someone was saying, oh, yes, my right SIJ, and they were pointing here. That's not the SIJ. The SIJ is round here, and really it's kind of like a line, as you guys can see on the model here, right? It's very, very common for you guys to get symptoms in that region around here associated with the injuries that you have in the lumbar spine. Storyteller, how many times do we do a hip hinge in a week in a day? You just follow the program in that scenario. My physiotherapist told me that laying down on my tummy, told me to lay down on my tummy and press. My hands against the floor, The exercise will help. Oh, you're talking about doing a Cobra. Yeah, no. In fact, this will be helpful. Hopefully this will anyway. A lot of people don't quite understand the Cobra, and this might be one such scenario. So for Magdalena and others that are interested, if you're watching on TikTok and you want this video, just send us a DM and say, hey Matt, can you send me a video, a link to the Cobra? But watch that video, Magdalena. That's generally speaking, yeah, people will say that with the Cobra, but I don't think it's particularly good. The towel is better. The towel stretch is better. And for a lot of people with a lower back injury, especially if it's L5S1, they find that the Cobra actually aggravates them. And let me show you guys why. I'll grab the spine. This is an important point of reference, and the reason I'm covering it is because I don't cover it in that video. But the visual is actually quite helpful in you understanding why the Cobra is not the same. Just unplug that there. Is that right? Ah, there we go. So, if you think of this as your spine, the reason I'm getting this is because it's concertinaed, so you can see how the length of the column changes. This is your spine. Notice the length. When I do a Cobra, I do a backward bend. So I just lie on my tummy and I push myself up. Boom. Okay? You can quite clearly see no elongation has occurred, right? What we're looking when we do a decompression to try and decompress the disc is do that, right? You see how they came apart? That's what the decompression does in the room in the other room, on the table in the other room. When I do the towel, instead of just doing that, if you look closely, I do that. Now you can see that there is some elongation because the weight of the pelvis on the one hand and the weight of the thoracic spine on the other creates a bit of elongation and the restoration and support of the lordosis. Or we can do the bed decompression, which is a little bit more focused as well. Those movements are things that actually decompress. The Cobra is not as good. Storyteller said, after rehab, how do you get to the point where you can do heavy stuff plus MMA? Focus on the rehab, right? Sometimes we get so focused on everything else apart from doing the doing, we're focused on the future. You just feed it in carefully. The idea is that your rehab should be heavy stuff. The idea is that your strengthening work should be harder than you are reasonably going to be, or should be more strenuous than things that you are reasonably likely to come into contact with on a daily basis. Limitless has said, are assisted pull-ups okay to do? I tried 1 rep of the pull-ups, but it caused some pain in the lower back, which didn't make sense to me. Yeah, to be honest, I do the lat pull down. So have a look at the additional workouts in the additional workouts library. I couldn't think of the word there. No, have a look there and just revisit the phase 4 material on adding in the additional workouts. But I would suggest doing a lat pull down would be better than the assisted pull-ups. Primarily because it just makes it a little bit more controlled, is what I'd say there. Think more, one of the mistakes, so when we do a chin-up, like it's quite nice to like lean back a little bit, but what you will find often is when you lean back, you'll often jar your lower lumbar spine and that might bother you. So instead, think about your chest coming up rather than arching down and back. Like if you play around with this while you're sat down, be careful, but you can literally feel that versus that, like that, I can feel it jarring my lumbar spine when I come down. But if you elevate the chest up to meet the bar and then go, you'll feel it very differently in the lower back. You'll also feel it hits the lats really nicely. And with the pin, you're able to control the exercise an awful lot better, like using the pin stack, rather than trying to do the pull-ups. I think for a lot of people, like the pull-ups, it's hard. It's hard to do the pull-ups and do them well. And also then you've got the mounting and dismounting and the messing around with putting your legs on the thing. And I would focus instead on doing lat pull down, and Nirav, you're working out in the gym anyway, so I would just use a lat pull down machine instead. And I'd say if you're worried about it, one of the things I've been doing, the machine's not on. Let me turn it on. This has been quite a nice one. This is in the additional workouts, the asymmetrical one. I'd probably say this is better for you. This exercise is single arm. So single arm, so like so, and then coming down. So like so. That's in, I think, upper body workout number 2. I think you'll find that quite good. Quite a nice one. Really let your shoulder, your scapulothoracic joint come round and get that stretch and then squeeze. I think you'll find that nicer. And because you're using single arm, it's less load. You'll feel more controlled as well, but still be able to challenge the muscles in an appropriate manner. Oscar. Do calories matter on back rehab? I don't like it when people are trying to lose weight and they're giving themselves like minus 500 calories when they're trying to like lose weight whilst also trying to do the rehab. I feel like you're trying to burn the candle at both ends. I do think if you're trying to do back rehab, what are we trying to do? We're trying to build muscle tissue. And so while the beginner might well be able to get away with a bit of funniness in that scenario, I think generally just going on maintenance or slightly above with good food, especially from where you are, Oscar, you're in phase 4, you're doing well, you're 75 kilos on the squat now. I would suggest for someone like yourself, I'd probably be looking to build a bit of muscle and maybe even gain a little bit of weight perhaps. Muscle, of course, right? And so I'd suggest maybe just a slight surplus might actually be a good option. But certainly not a heavy a heavy deficit in terms of calories. I think that's a bad idea. Roy Jungle, what's the best exercise for back arthritis? Everything we talk about. Dead bug, marching bridge, squat, hip hinge, step up, single leg hip hinge. Do those, focus on technique first, then find the right weight that actually challenges you, then progress that weight over time. That's what we do. Paul has said here, moving to phase 2 exercises. Awesome. I've watched all the videos and I'm a bit lost on which variations of each exercise I should do in prep for the live workout. My lack of ROM really limits my ability to do these exercises. That's fine. Don't worry. You don't need to get past it. It's been a week. You don't need to get past it. You don't need to get past it at all. It will come in time. It will come. The main thing that you want to look at is just the loading on the load-bearing exercises. And primarily you want to focus on your squat and hip hinge. And for reasons of the limited range of motion, you're probably going to find the squat workout is going to be the main one that you will scale in phase 3 sooner rather than later, while you're continuing to refine your technique on the hip hinge. But understand, oh yeah, I've got one here, right? All we're doing is changing the choreography. If you want to use your phone as a weight, you can hold your phone as a weight when you're doing the squat. It doesn't need to be scary. I'm being tongue-in-cheek here, right? Hold your phone and do a weight. Hold your phone and do a step up, right? That's a weight. It's a couple of 100 grams. Okay, maybe that's not enough. Maybe hold a massage gun and do your step up, right? It doesn't need to be scary. Keep the same variations you're doing on the dead bug and the marching bridge, and focus on just making sure we're comfortable holding something on the squat and the hip hinge. And again, you will only be there for a very short period of time. Once you've got the individual comfort of the routines down and you're able to follow on live without any aggravation, move on. Don't judge yourself as to where you are. That's the biggest mistake. And I've seen a couple of comments on this, and we get it from time to time. People judging themselves. Oh, but I'm not very good at the hip hinge. Sure. I don't expect you to be. If you came into the program and you're doing everything textbook perfect and you've just thrown a ton of weight on the bar, then I'd be like, this is out of the ordinary. I expect you guys to not be very good at these things. I expect you guys to have limited range of motion. I expect you guys to struggle with some of the exercises more than others. Don't judge yourself for it. Just accept it. That's where you're starting. That's where you're starting. Some of you guys have been struggling for a long period of time. So just accept it. You will get better. It's great if you're recording yourself, which you should be, and you'll see the difference over time. Paula said, how important is nutrition on the plan? I've always had a high protein diet, which is good when I could work out properly. Will this help? Yes, it will. Yes, it will. Or rather, too many people have a low protein diet, and that does not help. So if you're eating whole real food and you're getting enough protein on a daily basis, fantastic. And what enough protein is, I would personally suggest that is around about 1.6 grams per kilogram of body weight, or a gram per pound, maybe at top end. What else have we got here? Nirav, yeah, I remember. Yeah, do check upper body workout number 2, Nirav. That'll be good. Charlotte has said, I'm 9 weeks after an L5 disc herniation. Started doing swimming as part of my rehab. Oh, that's interesting. Is there anything in the pool you can do to help strengthen and stretch my back? My biggest recommendation to strengthen your pool, I hope this is helpful. The biggest thing you can do in the pool as part of your rehab to help strengthen your back is get out of the pool, right? Being in the pool is not helping your rehab. Being in the pool is not getting you stronger. you need to do land-based rehab, because by definition, rehabilitation is about rebuilding strength and resilience into the tissues that are damaged and weak, vulnerable. All tissues by definition, if you've injured a joint, it's weak because it's been broken, right? It's like saying a shattered glass is going to hold water better than a non-shattered glass. It's been damaged, right? It needs to heal. Healing is a strengthening process. Strengthening requires load, and you are going in a low load environment. By definition, it is the antithesis of strengthening if you're going in the pool. Now, that's not to say you can't go to the pool, right? But we need to appropriately, and this was good, very similar to another earlier question on acupuncture and hydrotherapy, I think it was as well, actually, interestingly enough. The salt baths, that was it. You need to understand what is doing what for your back and how. So we have swimming. By swimming, I'll be honest with you, the best benefit you can get from swimming is just go and float in the pool. A low gravity environment. Takes pressure off the discs. That's the same as the towel decompression, the bed decompression. You're doing something to create a relieving environment, relieving stress and strain of daily life. Strengthening is done on land with load. Maybe just with body weight to start with, but progressively with load. This is very important. So there's rehab to build strength, which is done on land, and then there is relief-based practices, towel decompression, the bed decompression, lower body stretching, contrast bathing. All of these kind of things are helpful in easing the inflammation in the lower back, but they are relieving. Now, I would argue on the topic of swimming specifically, if you're early on in the recovery process, for example, we're talking about 9 weeks in Charlotte's case, this is why doing the rehab is so important. How good are we at the squat and the hip hinge and the dead bug and the marching bridge? Because unfortunately for a lot of people, you're really not very good at them. And so the action of getting to and from the swimming pool, getting changed, getting showered, taking off a sticky swimming costume, getting back in the car, going home, unpacking, hanging up all your kit. As you can tell, I spent a lot of time when I was a teenager doing swimming. 13, 14, 15 hours a week through my teenage years. It's not the most enjoyable, right? But you have to ask, is that worth it? Is the benefit that you got, and this comes back to treatment, right? Is it beneficial for you while you can't even control yourself, traveling 45 minutes, an hour, half an hour to go and get a treatment where you're going to get back in the car and drive home? They've decompressed your spine and then you just squash everything down and mess everything up. So getting a good level of strength is actually quite important. And that's what we do in the program, right? Phase 1, 2, 3, 4. You're building strength, you're building technique first, and then you're building strength in the latter stages of the program. I actually think using the pool, where you guys go to the gym and you have a pool, maybe a sauna, spa, that kind of facilities alongside, I think actually the mid to late stage of the program of the rehab is actually where something like swimming can be more helpful, because you do your hard workout, you've just increased your weights from 12 to 15 kilos on the squat, and then you go and jump in the pool, and you're competent enough at this point, you've built a little bit of basic body control, that actually the action of getting in and out of the pool isn't problematic for you anymore. So you can benefit from the relief and not mess it up straight afterwards. So I would argue maybe swimming actually is perhaps more of a mid to late stage benefit on a relief-based strategy, rather than actually something that the early individual should do, even though you guys are often sent to hydrotherapy because they're like, that's the only time we can get this person out of pain. So yeah, but that's not contributing to the recovery. You've got to do stuff on the land. And that starts with technique on the rehabilitation exercises. So hopefully, Charlotte, that gives you guys you something to think about there a little bit. Now, if on the contrary, you have a pool in your garden, then kind of ignore what I just said, right? Because you can go and just walk out into the garden, go in the pool, and come back out again. I know some people have that. They live next to the sea or they live next to a lake, and they can just walk in, and it's not got the same effort. But if you're having to drive 10, 15, 20 minutes to the pool and back again, etc., 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 it raises the question, is it really worth it? Just looking over some of the other comments over here on TikTok, what else have we got? And then I'm going to come back to YouTube, which seems to have quite a few guys. Appreciate it. Brendan has said, I'm still having some leg pain after a follow-up scan. The specialist says the disc is not re-herniated. Brendan, the biggest question is, have we done the rehab work? Have we done the rehab work? Have we done the strengthening work? That's what we want to be looking at. Oh, wow. That's been an hour already. Are you kidding me? 54 minutes. Okay, TikTok's asking me a little bit early. Just looking through some more of the comments here, guys. We're getting towards the end of today's live, guys, so if you've got any questions, please do post them in sooner rather than later. And by the way, if you need any more support, any more help, check out the link in the profile page. Guys, those of you on YouTube, if you're watching for the first time and you've been struggling, head over to the website, There's a little bit more information over there. I'll just put the link in the chat. There's a video here that explains a little bit more about the program. Watch the video there, just so you guys get a bit of a better understanding. Just coming back to the questions here. Thank you for your answer. The exercise which my physiotherapist told me to do made me so much worse. I was in better physical condition before I started the sessions than when I was after 8 weeks. I regret listening to her. Yeah, I mean, it's tough. That's why we try and do this education. The Cobra, I mean, it's going to aggravate you. I don't think you're going to make things substantially worse, you know, in terms of the forces that are there. It's not, the biggest worry is like you guys, I said this on a call the other day. If you're watching, you'll know who I'm talking about, or you know, we had the conversation. Some of you guys like sincerely, you feel like your back is a tower of Jenga. And if someone pokes it a little bit, the whole thing's going to crumble. And that's not the case. And as vulnerable as you do feel, and as much as you can mess your back up and you can create irritation and aggravation, yes, you can, but it's not that vulnerable. It's not that vulnerable. And the damage that you've done by doing things wrong is generally just the repetitive strain of them, creating little bits of worsening over extended periods of time. And allowing the scab to be picked and more scar tissue than is necessary to be forming. And so you're not going to be making things substantially worse, especially where the forces are not significant. Now, granted, if you're going to fall out of the window that's up there onto your back, that would make things substantially worse, or very, very plausibly could. So just bear that in mind. I know a lot of you guys will feel very, very vulnerable. But just bear that in mind. It will give you a little bit of comfort at the very least. Roy has said, why I don't feel my glutes when squatting or doing the bird dog exercise. I don't think you will doing the bird dog exercise, and when you're squatting, you're probably not challenging yourself appropriately. Which is not direction to go and load up a ton on the bar and start squatting heavy, right? That's not what I'm telling you to do. But guys, you guys have an injury to the lower lumbar spine. It controls these areas, the glutes, hamstrings, etc. Accept the fact that you might not feel things properly. A lot of beginners that train struggle to feel things properly. It takes a bit of time to establish this degree of what might be called mind-muscle connection. And you're just a beginner. You've just started doing the rehab. And quite honestly, a lot of people that have been working out aren't necessarily working out that well either. Of the few that are, we're not necessarily all doing it so well. And so acknowledge that you're not very good at feeling it, but you don't need to read into that anymore. And too often you'll have a very, very willing physio or osteopathic and say, oh yeah, your glutes aren't firing. Yes, that's your glutes aren't firing. We've got this special convoluted thing that we can do to get your glutes firing again. It's like, leave it out. You've got an injury. It's perfectly reasonable for you to experience sensory disturbances, i.e. pain, numbness, tingling, and motor disturbances, i.e. you don't feel your muscles that good, right? It's perfectly reasonable. Focus on getting better and you notice that a lot of these things fall by the wayside. Magdalene said, I'm going to sign up to your program after the live ends. Awesome. Awesome. Just make sure. The biggest tip I can give you guys when you start the program, follow the material. Strategy. When you start, there are strategy videos for each of the phases. You start with phase 1 because 1, 2, 3, 4. 1 comes before 2, 3, 4, right? At the same time, you look at the strategy videos in the core relief section. Those two relate to one another, and you will continue to do the core relief work through the entirety of the program. It talks about this in there. So you're doing rehab and relief-based practices, and then progress through. But please follow the strategy material and leverage the support in the members area. But make sure you follow the strategy material first. Very, very important. And then you go and look at the tutorials on the exercises, and then you know how to go about doing the tutorials on the exercises and following through with those. And record yourself. I was speaking to someone the other day. They said, oh well, I didn't do the tape test, or I didn't record myself just yet because I wanted to try the exercises first. I was like, that doesn't make any sense at all. None. That's like saying, my child's learning to ride a bicycle, we'll stick them on without the stabilizers first, just so we can verify that they're going to fall over, and then we'll put the stabilizers on afterwards. A video is your stabilizer. A video is your safety net. A video should be used from day one. Watch the video, record yourself. If you're not doing this, why? Oh, well, I want to get better. Do you know how you're going to get better? Watching what you did afterwards. Because what you think you're doing and what you're actually doing are often two completely different things. The sooner we can realize that, the better. Because you are necessarily going to go through the process of making mistakes as you learn. Because if you knew how to do this already, you wouldn't be watching a video on back pain. You would be better. And that's a really important realization to have. If you knew this already, you wouldn't be here. So record yourself. And I would argue for some of you guys that are particularly worried, record yourself every time. Are we serious about this or not? The videos will also serve as measuring sticks that you can go back and reflect upon later on. They have a multitude of purposes. So make sure. And Magdalena says, I'm worried that I will struggle doing the program on my own. I guarantee you, you have more support in the program than you do from your local physio. This is the irony of it all, right? Having worked in clinical practice, or our clinic, before we had the program, and having a program now alongside clinical practice, the difference is night and day. And unfortunately, we're still, COVID has moved things along a little bit to where people actually are more appropriate, more receptive to doing things online. But guys, you see a clinician, right? You go through an hour session. Let's assume you've got an hour appointment that costs you £50, let's just say. Maybe it was more, maybe it was less. That 1 hour, you're going to have a bit of niceties and a bit of debriefing at the end, and then you're going to do some stuff in the middle. You're going to forget probably 75, maybe even 90% of what has been spoken about. So you benefited from 5 minutes and it cost you £50 and the inconvenience of going there. Then you're at home for the next week, fortnight, maybe a month. The idea that this is safer than doing an online program that has support is laughable. You will watch probably an hour, maybe 2 hours, maybe more, certainly if you're doing all of the stuff properly, much more, before you even start doing an exercise. And you know what? If you forgot what you said, you go back and watch the video again. You can't do that with your clinical appointment, and it's at a fraction of the cost. It's at a fraction of the cost than that £50 appointment for what you'll probably retain is maybe 5 minutes worth of the chat. Very, very important to realize. People are worried about doing it on your own. You're not on your own. You've got videos. You've got a whole library of videos, and you have support from the members area. Us in the members area to help you guys along the way. I think that's one of the biggest paradigm shifts, understanding that actually the in-person appointment cannot possibly compete with the online environment, because you will need to revisit things. How many times have you learned things in your life where you got shown it once, you had a conversation once and you got it right perfectly every time after that? Probably none. If you're like me, a mere mortal, you probably never got it right first time after. You needed to revisit something. Well, you can't do that until your appointment in 2 weeks' time. Oh, and there's an additional cost there as well, of course. We don't seem to compare these things. It's something worth really reflecting on. So if you are feeling worried, oh, I feel like you're not on your own. That's the whole point of the program, is that you're not on your own. Oscar said, I feel the pain in my disc if I touch a finger like number 4 toward my upper back from last week. I feel the pain on disc if I touch with finger towards my upper back. Oscar, can you give me a bit more guidance, a bit more advice on that? Oh, sorry, a bit more, not advice, commentary on that. Maybe you give me an update, a little bit more context in the group, just so I can digest it a little bit more effectively. I think you're talking about the middle back there. Just looking back through some of the comments here. JMX says, does it matter if contrast bathing finishes on hot or cold? Generally speaking, guys, I would try and finish on cold for your lower back. When I was doing my eye, so that's one of the cool things about the cube, right? That's why I recommend the cube, because it's always like, you want to get the most bang for your buck. I think the cube is actually really good because you can use it anywhere. So I was using it on my eye to help with the drainage of inflammation last week. And in that scenario, I'd finish on hot. But with your lower back, I'd finish on cold down here. I'd always try and, so the cube, for example, it finishes on hot by default. So I just do an extra little blast of cold. Magdalena said, it's not just the Cobra exercise, knee hugs, pelvic tilts, child's pose, rocking my knees. Yeah, none of that is rehab. That's not rehab. That's just stuff, right? You're just moving. You're just moving. That stuff is not rehabilitation. Ultraviolet said, is the rehab routine the same for facet joint hypertrophy? We have to understand what we're saying when we say facet joint hypertrophy is not an injury. Facet joint hypertrophy is saying that the bones have enlarged. Why do the bones enlarge? Because you keep injuring the segment and it keeps going through, having extra strain go through it to the point where it's been happening for so long that the bones have changed. You can see my finger from jiu-jitsu, this one here, right? It's enlarged because it keeps getting injured, caught in the gi and this, that, the other. So the bone has changed. The bone enlargement, hypertrophy, is not the problem. The problem is I keep injuring the soft tissues. So ultraviolet, this is where we're trying to be too reductionist in our diagnosis. I know I talk a lot about the discs. The segment is what you have injured. The segment is what you need to stabilize. Whether the primary region of the segment that is driving your symptoms at present happens to be the facet joint, well, that's very difficult to actually ascertain because generally speaking, a provocative test for the facet joint, if I just use my neck so you can see it better, is to look up and to that side. I compress these facet joints, ouch, it hurts. It's the facet joint. What you don't realize is that when you do that and that to the same size, you also close the hole where the nerve comes out. So if there's inflammation in there, you can also be pinching the nerve. So how do we know it's actually not the facet joint? And that's just an additional artifact that we notice. Like treating stenosis. You don't treat stenosis, you treat the cause of the stenosis. And so what we've got in that scenario is we've got signs of a repetitively injured segment in the lower back such that the bones of the facet joints have become hypertrophy. Do you know what else is going to cause facet joint hypertrophy? The disc height dropping, because the disc separates out bone 1 from bone 2. And do you know what was on the back of bone 1 and bone 2? The facet joints. So if the disc height drops, the facet joints will be more likely to bang into one another in a disadvantageous way as well. And that's why it's most helpful for you guys to think about the segment being injured. The surgeon needs to know if it's a disc bulge on the left-hand side or the right-hand side or this, that, the other, because that's what they want to chop out or poke with something sharp. You guys need to understand that the rehab doesn't change, whether it's primarily your facet joint, whether it's a spondylolisthesis, whether it's a disc bulge or herniation, whether we've just had surgery, whether we've had a fusion. The rehab work doesn't change if it is focused on spinal stability. If we're talking about funny, quirky positions that you might get into to relieve your sciatica or your back pain, or your facet joint hypertrophy in 3.5 minutes, then yes, knowing that it's the facet joint on the left-hand side and getting into that position like so will decompress the facet joint and feel nice is cool. That's not rehab, that's not providing any long-term benefits. That's the kind of quirks that you'll see on social media that unfortunately get you guys hooked on something that is a temporarily relieving position that is only serving to make things worse. Roy has said, the physical therapist told me core workout is not going to heal your back. He recommended cat-cow. The physical therapist is speaking inappropriately. Okay, firstly, I think we'll wrap it up here, guys. I'm overrunning again. Man, it goes by so fast. Okay, guys, before I get into this question, as you guys on TikTok, hopefully it's been helpful. If you need any more support, do check out the link up in the profile page. If you want to watch the last bit to this answer, I'm going to go through it on TikTok, but I need to close the, sorry, I'm going to go through it on YouTube. So you can head over there, guys. Hopefully it's going to be helpful. And again, we'll be live later this week. Thanks to all of you guys that posted. And sorry for those comments on TikTok that I didn't get to. We've got it all on YouTube over here. So thanks, guys. Take care. Now, to that question, because that is a very good question. Move that out of the way. Rehab does not heal your back in the sense that you guys are thinking about it. No one heals your back. You heal your back. Just like my cut up here, okay? I'm not sat there going, can someone please heal my cut? I'm also not sat there going, heal, 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 heal. It happens on its own. You guys need to understand, healing happens on its own. With regards to the lower back, with regards to my cut, if I keep picking the scab, which I've done once or twice, unfortunately, because it was just so annoying, it's going to heal more slowly. I'm going to have more scar tissue and hey, in a couple of weeks' time or a couple of months' time when I'm doing a live stream, if you happen to see a scar there, well, that was my fault. Sorry. Or sorry to me, right? If you keep aggravating it, as most of the reason you guys don't get better is because you are interfering with the healing process. The cat-cow and the child's pose and the knees to chest is a great way of interfering with the healing process. It's a great way of picking the scab because those tissues at the level that are injured are trying to knit back together. And what you're doing is wiggling them all the time. You see this on example. If I just took the wound here and just pulled the skin taut, I'm going to rip the edges of the wound and it's going to start bleeding again. When I pick the scab, I pulled it, stretched the tissues, and it's going to start bleeding again. Doing those kind of movements is certainly going to be interfering with the recovery process. Worst case scenario, you're making it significantly worse. Best case scenario, you're just not getting better. Your rehab does not do healing. You heal. What does your rehab do? What does the core rehabilitation work do? And also bear in mind, your physio probably thinks when you say core exercises, they don't really know what you mean. Or they will assume what you mean, and it's probably not what we mean, and it's probably not what we're doing. Although some of the core exercises might well be ones that they might be familiar with. How they're familiar with them, and the specific nuanced way that they instruct those exercises will also vary. And so that's something to bear in mind. The way in which rehabilitation work, which would include core work, helps you get better is that it, firstly, in, for example, phase 1 and phase 2 of the program, and to a lesser degree phase 3, you are learning how to move technically correctly. You are doing a squat so that when you get out of a chair, you're doing it in a way that doesn't compromise the lumbar spine. You're doing a hip hinge so that when you get dressed in the morning and you lean forwards to put your socks on, you're doing it in a way that doesn't compromise your lumbar spine. You're learning how to control this section so that when you're moving around and you have to do something, you can stabilize the core and not be bending your spine all over the place. You're getting an awareness. So your rehab work in the early instance improves your technique so that you are less frequently aggravating the injury. And if you pick the scab less frequently, you are indirectly helping the healing process by just not messing it up as frequently. Second, where it kind of does help the healing process, is that it's very difficult to pass out where healing stops and strengthening begins. Because fundamentally, the process of healing is re-strengthening the tissues, and the process of strengthening could be said as, excuse me, continuing to strengthen the tissues further. And so that is where your rehabilitation is directly guiding the process, and it's guiding the process. And what I mean by that is, it is creating the stimulation that when you do your squat with load, and you put load through that herniated disc at L4-5, you are telling the disc fibers precisely that they are in need of being capable of bearing whatever kilos that you're putting through it. And that is how you respond to training. No different to how you respond in your bicep. You expose the bicep to a load that is just at the right point where it struggles to deal with it, but does not create injury. So it creates micro trauma that the bicep then recovers from, and then is able to bear more load or more strain. That's exactly what's happening in your disc. So your training is making use of a phenomenon within the body which is very intelligent and miraculous in many ways, that you can expose it to the right level of strain that will guide the cells in those tissues, the discs, the bones, etc., to lay down more substance that increases their resilience. Now, this happens over a long period of time. We're talking about weeks in muscles and months in the discal tissue. But that is how you are actually directly strengthening those tissues. So while we could say the core workout is not going, well, they're wrong to say the core workout isn't going to help you, but it's not going to help you strengthen, let's say. It's not healing you, sorry. I misspoke. It's not healing you. The core work is not healing you, but it is guiding the healing process and the strengthening process, particularly in the latter stages. So I do hope that makes sense and rounds off the discussion reasonably nicely. Guys, I'm going to call it there. Hopefully the session has been helpful. I can see a couple of you guys have dropped in at the end. So if there's any questions while I'm going through this last little debrief, then you guys can post them in the comments and I'll try and get through them before I end the live stream. We'll be going live again on Friday, probably Friday late morning UK time. In the meantime, those of you guys, if you need any more help, any more support, Oscar specifically, I mentioned your comment, please do get in touch with us in the members area on the website, on the group. And just a reminder that we do have the Black Friday sale for members that is live now. Just reach out to us if you want to, or just click the link in the email that was sent out and you can upgrade there or take the offer there. If you've got any questions about the Black Friday offer, just send us an email, guys. Please do. And yeah, just reading some comments coming in from Tara, said, I enjoy these lives just for your analogies alone. Thank you for making our rehab simplified rather than more complicated than it needs to be. Yeah, I think too often we are, and sometimes when we've been struggling for so long, we feel like there has to be a complicated solution, because if the solution was that obvious, then I would have surely someone would have told me by now, right? But I think sometimes, especially in, you guys will know this from various different disciplines. The medical discipline certainly is guilty of this. The legal profession, I would say, is certainly guilty of this. politics, everything, right? They often use words and concepts that unnecessarily create complexity to make it feel like you can't understand and you need that special person to help you, the simpleton, understand it. And that's just not necessary. Those people are often making things unnecessarily complicated. We can all understand it, right? You don't need to be made to feel inferior in some way because someone's making it sound unnecessarily complicated. That is really, you know, I think you definitely get, like, when you're in this stuff and you're reading about it, it's really cool to go into the detail, the technical detail. And that is really, really interesting, right? But it's not that complicated. And the ability to just make it simple is, I think, quite important. It's quite important because it doesn't need to feel so out of control. So many of you guys struggle for such a long period of time because you feel like it's beyond you, the solution is beyond your comprehension and no one really understands it and everything's so complicated, but it's really not. It's really not. It's really not at all. And it's just a case of having that pointed out to us. And that's why we try and do these lives. And hopefully those analogies, they make things a little bit more simple. They make things a little bit more accessible for us all. Because you start reading some of this, you know, the academic literature and you're like, man, there's a lot here. There's a lot here. And it seems very, very complicated and very, very convoluted and this, that, the other, especially with all this stuff about the pain in the brain. And you're seeing so much of that nowadays. And speaking to friends who are in the discipline, osteopaths who went to university with, I'm thinking of one in particular who was going to one of the physiotherapy universities because he was getting an additional physiotherapy degree, I think for injections, I think it was, for the ability to do injections. And he was saying the way in which they're changing the education, they're just moving away from an anatomical understanding and going full bore into all of this pain is in the brain stuff. And it doesn't really matter because everybody's got a disc bulge and everybody's got bad joints. And if we just talk about it, it'll get better on its own. And it's really not helping people. And you've got even disciplines. I was speaking to a chiropractor. I said this a little while ago. I was speaking to a chiropractor a couple months back, maybe 6 months ago. And he was talking about the way in which even the chiropractic colleges, which tended to always be, you'd always say, you know, me as an osteopath, chiropractors would tend to have a little bit more exposure to the spine or made a bigger deal out of understanding this thing than the osteopaths. Not massively, but they did. And even the chiropractors at their universities are moving away from this kind of anatomical, or see it from what I've heard anyway, are moving away from this kind of anatomical understanding. And you'll get people posting in the comments saying, don't you know that's out of date? It doesn't matter about the spine anymore. And all it's doing is just confusing patients. It's not working. It's not working for a starter. It's not helping people. And yeah, so hopefully that's been good, guys. Look forward to seeing you on Friday. Members, if you need any more support, any more help, you guys are, please do get in touch in the members area. And Jungle, thank you for the comment. I'm an osteopath rather than a physical therapist, but I appreciate the comment nonetheless. So thanks, guys. Have a great afternoon and see you next time.